Well, good morning, and thank you both for joining us this morning. My name is Andrea Saikon. I'm the Vice President of Talent Acquisition here at Tampa General, and welcome to our TGH Talent Talks. The intent of our podcast is really to inspire and educate the next generation thinking about careers in healthcare, understanding we work at Tampa General. We are a 24/7 operation. We're arguably a little city with about 11,000 team members and over 800 different job pathways that you can go into. So I will introduce both of you, invite you to share a little bit more about your story, and then we'll get into a really fun conversation this morning around how did you figure out your career path? What do you wish you could tell your 20-year-old self? For those that might be watching and thinking, do I want to become a transplant surgeon? Do I want to become a surg tech or a nurse? All right, so we'll start with introductions, and Dr. Chloe Wang, we'll start with you.
Okay. Good morning. Thank you for having us, Andrea. I'm Chloe Wang. I'm one of the kidney pancreas transplant surgeons here at Tampa General.
How long have you been in your field? How long have you been at TGH?
I've been at TGH for about 10 years now. I did my residency and fellowship here as well. So I did my general surgery residency with the University of South Florida for 5 years. Then I stayed to do my abdominal transplant fellowship with Tampa General. After my fellowship, I came on as a staff surgeon. So I'm in my 4th year as a staff surgeon.
Awesome. Mm-hmm. And Jack, welcome.
Thank you. So one thing is you're right about the Tampa General. Like it's like a little city and it never sleeps. But my name is Jack. I'm a surgical technician. I've been at Tampa General since 2016. I came in right out of high school. My parents both worked there, so they kind of gave me a way in or an idea of what to do because I really had no idea what I was going to do coming out of high school. So I started as an ORA, an operating room assistant, and then just transferred to CST a couple of years ago. I think 2022 was the year. And so I've been doing that now for about 2.5 years.
So this is a trend that we see often in healthcare, right? As if I grew up in a household where my parent or my aunt or my sibling was a blank, I know that that's a pathway for you. So it sounds like you grew up in a household where both parents were nurses, so you knew kind of a healthcare path was where you wanted to go. What about for you? Did you grow up in an environment where healthcare was the norm?
Mm-hmm. Yeah, both my parents were in healthcare. My dad is a physician. My mom was a nurse. So I really grew up very familiar with the hospital setting and healthcare.
That's interesting. So one of the statistics that I was reading about recently was talking about of transplant surgeons, only 12% in the United States are actually female.
Yeah.
So you are really in a unique position when you think of inspiring career paths. So talk to us a little bit about how you knew this was the pathway that you wanted to take, and what was your first intro into healthcare outside of your environment where you grew up?
Yeah, transplant surgery specifically is a very male-dominant field, but I think that is changing. More than ever now, female residents are, I believe, either half or more than half of most general surgery residencies. And from there, we're trying to inspire, the future generation of female surgeons to become transplant surgeons, cardiothoracic surgeons, those subspecialties that have typically been male dominant. For me specifically, I did not know I was going to become a surgeon. My dad was a physician. I knew I wanted to do medicine, but I thought I was going to become an internist or some sort of non-surgical specialist. However, in medical school, once I experienced a surgical rotation as a third-year medical student, I knew it was over. I was going to be a surgeon. I had the personality to be a surgeon. I liked the instant gratification of working with my hands, the results of making patients better. And as far as transplant surgery, I did not know that was going to be my path until my PGY 4-year in residency when I did a rotation on transplant. And at the time, Dr. Vic Bowers was still around, and he was such a giant in the field, especially at Tampa General. And he was such a mentor to me. He was a fantastic surgeon, really experienced diagnostician, and I wanted to be like him when I grew up, so to speak.
That's awesome.
Yeah. So I would say in the field of surgery, or really anything, having a great mentor can go a long way in helping you decide what you may want to do.
So Jack, tell me a little bit about your pathway. So how did you realize, mom and dad are both nurses, you could go to nursing school, you chose the surg tech route, the OR assistant route first right out of high school. Right. Talk to us a little bit about your journey. What was involved in the schooling that you took? Were you working full-time while you were juggling clinicals? Tell us a little bit about your journey.
So I'm going to start a little further back. So my mom, straight out of high school, she went to college, did the normal route, became a nurse really early. So she was a nurse for 45 years, just recently retired.
At Tampa General?
At Tampa General.
Very cool.
So my parents lived in Ohio, and my dad worked in a factory, Goodyear Aerospace, and he was, it was really unionized, and so it was kind of volatile with the strikes and everything. So my mom suggested to him, you should go to surgical tech school, find something a little more stable. They're hiring in Akron, at her hospital. So he decided to transform his role to that, and then they moved to Florida. So I saw how he changed his life with that, where going from somewhere where he was a really manual worker, like a blue collar kind of guy, and transferred to surgical tech, which was, more healthcare, more involving your brain, a little more critical thinking is involved. So after he was a surgical tech for 6 years, he decided to go back to nursing school and become a nurse and further his career. So I like to think that I'm following his footsteps in a lot of ways. When I was in surgical tech school, I worked full time, so I never had a day off. I had clinicals during the week, and then the weekend overnights, I was working 12 hours every day for the weekends. So it was a lot, and I saw the people who didn't have a job, who after clinicals they could go home and take a nap and enjoy their weekends, and so that was kind of like, it was motivating to me as well. I'm in nursing school now, and the same principles apply. I go to clinicals for 8, 10, 12 hours, and then I follow it with a shift of work. So I think the grit and the tenacity is going to carry with me into my nursing career and further on.
That's awesome.
Yeah.
That's very neat. You had good mentors growing up to kind of see that transformation from your parents. So let's break down a day in the OR. So we know that surgery and patient outcomes cannot happen without the partnership that the two of you have. So let's kind of spend some time on what is a typical day in the operating room. If somebody is watching this and they're saying, I think that's a path I might want to explore, talk to us a little bit about a typical day, if that exists.
Right. Do you want to start?
Oh man, I don't know if there is such a thing as a typical day, especially in the life of a transplant surgeon.
That's true.
I would say things are ever-changing, dynamic, plans can change, but if it were an ideal day, I would be in the OR all day, starting first thing in the morning. Everything will be ready, patients will be ready, the room will be ready, and then we just, roll on, one after another. Hopefully can get 3 or 4 transplants in. That would be an ideal day.
Okay.
Yeah.
What about for you?
Like she said, it's very dynamic, but I like that about the job. It's not just day in, day out, you're sitting at a desk. It's dynamic. Things change all the time. I think that makes it fun. So I think an ideal day in the OR is anything. There's no certain box or criteria that I look for, because if you expect it, you have to expect the unexpected.
Let's break down your job a little bit further. So what are the duties, responsibilities that you do? The minute you're driving into work, you park in the garage, you put on that TGH badge,
right.
You walk through those doors.
Right.
What happens next?
So we have a status board normally when we come in, and we can see our assignment. So we see, are we doing transplant today? Are we doing an emergency? Are we doing cardiac? There's various vascular. There's different services that work on our floor. So we see what we're assigned to, who we're with, and based on that is I think we open up a door of communication with the doctor to see even further of, what are we doing? What's the patient status? What's the case status? Is it the first time, second time? So we see that, we kind of get a foundation of what we're going to do. And then once we find out what case and where they're at, there's also, has it been started? Has it been set up? Is it almost finished? Are they closing? But ideally, we go in and we find that out, and we set up for a sterile field. If it's not already set up, we protect the sterility of that field, because there's a lot of moving parts in the operating room. People are always walking around, running around, so we have to there's an invisible force field around our table and our sterile supplies. So once the case starts, we assist the doctor in whatever they may need. We pass them instruments. We always have to stay a step ahead of them too. Kind of like anticipate is the word that we've always It's kind of drilled in our head, anticipation, being one step ahead. So I think a lot of times, like from the outside, people think that they ask for it and then we have to look for it and hand them the instrument. We don't know anything about the surgeries, but really we know pretty much the ins and outs of it, at least a general sense of it. So we always stay a step ahead of them and assisting the doctor and protecting the field. We also break down the field at the end of the case and make sure that everything follows suit because the sterile processing starts on our side. It doesn't start when the instruments reach the SPD area. So yeah, we just try to stay organized, stay ahead.
Why is the sterile field so important in healthcare?
Well, the sterile field is important because it protects our patients. The more sterility you have throughout the case, the better chance they have of not getting an infection. So I think it also starts, sterility is a main component of infection prevention for sure in the operating room.
Really important piece. What about from your perspective? So you driving into work, you park in that garage, you put on your badge. Mm-hmm. What happens next?
I walk straight to the OR. I check in my patients in the preoperative area. I let them know that I'm here. I'm ready for them. I mark them if I need to, sign all the paperwork, make sure all the notes and charting are accurate and complete. Then I usually change into my OR scrubs, go into the room that I'm going to be in, see who my team is, including my circulating nurse, my scrub tech, anesthesia team, and then just let them know what I'm anticipating. Just like Jack was mentioning, if I'm like, hey, this is a kidney transplant, I need this, and that, or hey, it's routine, or say, hey, this is the take back for bleeding, this is what I need. These are the extra things that I'm anticipating. So just what Jack had mentioned, opening the line of communication is really key before the patient get to the room. And then hopefully the case starts on time. And having a good team in the OR is so key. Like having an experienced nursing team, circulating team, scrub tech, and also the anesthesia team, so it can really make or break your day. And that's actually why I love working with Jack, because even though he hasn't been doing this for a very long time, he's probably one of my favorite surgical techs to work with. Because like he said,
take the wins.
Yeah,
right.
He is steps ahead of me. He does not just hand me the things I'm asking for. He has it ready before I ask for it. And that is the epitome of a good scrub tech, knowing what's next, anticipating. A lot of times I say, I don't want to talk to you. I want to put my hand out, and what I need is in my hand. And I feel like sometimes that's Jack. That's why. And he doesn't do the morning shift. He comes in a little bit later in the day, so often he'll relieve people who are already in my room. And I'm always like, hey, can I have Jack? Can I get Jack in my room? So that is what we look for in a good scrub tech, and he embodies all of those.
That's awesome.
Yeah. Very flattering.
Tell us about the partnership. How long have you two worked together?
Like I said, I've known her, like my parents actually used to work with her a lot. So when you were a resident, right? Mm-hmm. When she was a young one. And
our glory days are gone, huh?
So, they're still to come. So yeah, my parents worked with her for a long time, and then so I kind of knew her before. Like I felt like I knew her before I knew her. Yeah. In a sense.
We see each other around the ORs because he was an ORA, right? He was always around doing things here and there, and then he became a scrub tech, and it was evident right away that his skills were above.
Thank you, though. I really appreciate it.
Yeah, so we've been working together in like a surgeon scrub tech fashion since you started, I guess.
Yeah, probably
2022.
Maybe a little earlier because I did a lot of clinicals with you as well. So 2021 probably.
Okay.
Yeah.
Working hand in hand.
Chloe, you said something earlier that was really interesting when you talked about how you found your specialty in transplantation surgery. You said I had the personality for it. So talk to us a little bit about it. What is the personality of a transplant surgeon?
Well, I think of a surgeon in general as someone who, I don't want to use the term aggressive, but maybe who is a go-getter, who is motivated, who is an advocate for their patients, who wants something done and gets it done. And that's what I feel like I embody. I don't mean in like an abrasive way, but unfortunately as a female surgeon, sometimes that is what comes across. But I care about my patients and I just want to do what's best for them. And I want everyone around me in that operating room, on the floor, in the clinic. I want everyone to have that same goal.
I love it. I love that answer. Jack, let's talk a little bit about your schooling. So you both took different paths, but you're literally working together every single day for great patient outcomes. Some that might be watching this say, oh, you know what, the pathway to be a physician, that's a lot of school. Maybe that's a lot of student debt. I'm not sure I want to take that on, right? But they might be looking to you to say, wow, like this was maybe a 9-month program. This was a local technical school. Like, look at the pathway that I was able to explore. So talk to us a little bit about the schooling that you went through. You mentioned working and going to school full time and really not having those abilities to take breaks and naps. But talk to us a little bit about what was the schooling involved that you went through.
So I want to say that surgical tech was actually a plan B of mine. So my plan A was nursing. I did the prerequisites. I applied to one school. I didn't get in. So then I went to surgical tech school. It was my plan B. It wasn't originally my plan A, but I completely love the fact that I did it. I don't regret any bit of it. And as far as the working full time, Tampa General offers tuition reimbursement, which is amazing beyond. It's paid for every penny of school that I've ever went to. So I'm walking away debt free. I have nothing above my head. Which is amazing.
That's amazing.
So I really give kudos to, they have a great tuition reimbursement program. They really care about their students and like the education too, especially like my managers and the field in general. It's a teaching hospital, so they really care about students, and they know that students are also employees and employees are also students. So they respect the time management and the schedule changes and everything that comes with it. But as far as the schooling for surgical tech, it was a 15-month program. There was only a couple weeks off sprinkled into it, so there was no summer break or anything like that. The didactic portion was 6 months, I believe, maybe a little less, and then it was like 7 or 8 months of clinicals. And so the clinicals, I was there 4 days a week for 8 hours a day, doing what I'm doing now. They throw you right in the field. It's OJT training, which is awesome because that's the best way. The best way I learn is hands-on, visual learner, making mistakes, learning on my own. So it was 15 months, and then after the 15 months, you sit down for a certification exam, and then you're certified after that. That
is awesome. I think it's so important to share too, right? My first pathway is nursing, and then, decided to pivot and try something different. I think it's interesting. We were speaking with one of our medical assistant techs in one of our future podcasts, and what they shared was the average MAT fails the exam 3 times before they actually pass. So when you think about sitting down, taking that exam, fail, maybe opt out and say, I'll do something different, but the average is failing 3 times before they're actually passing the 4th time, which is interesting, right?
That is,
right.
Yeah.
If you didn't know that, you'd get really discouraged after the first or second time, right?
Yeah.
What about schooling for you? Schooling, and then when you think about walking away with no student debt versus I've got some payments that I have to keep making.
So I guess, right out of high school, I had to go to a 4-year university, and after that, 4 years of medical school, and then after that, 5 years of general surgery residency, then 2 years of abdominal transplant fellowship. And then voila, you're done.
Just like that.
Sounds
voila.
Easy.
Sounds easy.
But I always think of it like it's not a means to an end. That is my life. I'm living it. And every step along the way, I'm enjoying it.
That's awesome.
You never know what's going to happen. I was very open to different options. It's just like, I want to be a doctor. Well, what kind? I don't know. Let's see. I wanted to be a surgeon. What kind? I don't know. Let's see. And then but I truly believe everything happens for a reason. I'm very glad I do what I do now. I love my job. It's extremely rewarding, and I love that I help people every day.
So let's talk about the most rewarding parts of the job, and then let's talk about the biggest challenges, right? So a lot of times we hear folks deciding, do I want to go into healthcare or not? And sometimes we hear, I don't know if I want to be on call. I don't know if I want to do night shift. I don't know if I want to do weekends and give up time with my family. But we find a lot of folks do give those sacrifices to work in healthcare because we are a 24/7 operation and we don't close for major holidays. We don't send our patients home, right? We're always open. So we'll start maybe with you, Jack. What is the most rewarding part of the role?
So I think the most rewarding part is seeing the back end, seeing the results of your help and your assistance, and like Chloe always is handing out compliments, which it feels so good because you're not only helping the patient, but you're helping everybody involved. So that feels really good. I would say the most challenging is you can never go in autopilot. There's some jobs where you just come in, you do the same task every day. And so if you're not really up to the task, or you've had a long week and you have to go in and do more surgery, you can't just go into autopilot. So it can be a little mentally taxing because you have to maintain your critical thinking, especially in bad situations or even good situations. You just have to constantly be ahead. So I think that's a little taxing, but it's well worth it. I think on the back end, seeing the results and everything it's well worth it.
That's awesome. What about for you?
The most rewarding part is definitely, for me, being a kidney transplant surgeon, when we reperfuse the organ, as in give it blood again in the new recipient, and it starts making urine right there on the table, knowing that the surgery was a success and that we're more than likely getting another patient off of dialysis, which is one of the biggest contributors to mortality in the United States every year. That's just an amazing feeling. Just like what Jack was saying, seeing the actual results in the patients on the back end. As far as challenges, just like what you alluded to earlier, sacrificing your weekends, holidays, time with your family, but it's definitely doable. Being, I would say, relatively new mother and still being a surgeon, it's a balancing act. But with a supportive family and some good time management, it's very doable. And I find both of my roles at home and at work extremely rewarding.
Now I love all of your social posts, by the way. So I follow you on Instagram and I see your posts, and sometimes I see it's Women's Day in the OR. So it's an entire room from scrub tech to circulating nurse to you. Talk to me about what does that mean to see so many females in healthcare?
I think it's a change, the tides are changing in a way. And anyone in any gender can be in whatever role. Maybe traditionally the surgeon was the male role, and maybe traditionally the scrub tech was the female role. But as you can see right here, that's changing, and that's great. Anyone can do anything. I don't think your gender should limit you in what your interests are, what your passions are. And I love that more women are coming or doing different things in healthcare. I think traditionally, people always think of, you must be a nurse. And I get mistaken for that all the time. I'll walk into a patient's room and they're like, the nurse is here. I'm like, actually, I operated on you yesterday. But the thing is, healthcare is changing in that way. And I love that. And so people should be able to pursue whatever passions that they want to.
I think that's great. It's funny. My husband, when he says, my wife works at TGH, 9.5 out of 10 times, she must be a nurse. Yeah. And he goes, actually, no. Yeah. And as soon as he starts talking about people and talent and human resources, they're like, I never thought about that pathway in healthcare, right?
Yeah, exactly.
We have blinders on to think physician or nurse. And that's really like the whole point of this podcast is really to normalize. There's 800 different career paths. So when you think about finance, IT, marketing, there's so many pathways that folks just maybe are not thinking about.
Yeah, that's the beauty of it is you can make a lateral move, you can make a big jump, you can go anywhere in healthcare. You're never stuck. You're never pigeonholed to that.
So what's next for you?
So I have one more semester of nursing to complete nursing school, and then we'll see from there. I'm thinking practitioner school maybe after that. Again, continue to move up, but one step at a time. One semester left. Gonna bring it home.
Awesome. That is awesome. Where are you going to school?
Hillsborough Community.
That's exciting. Yeah, Congratulations early. That's very exciting. And what's next for you?
Just keep on transplanting more patients. We have been setting a record year almost every year over the last 4 or 5 years, and I don't think this year will be any different. And we have to thank, my colleagues and all of our staff that help us do this every day, day in and day out. People like Jack, the nurses, the anesthesia staff, our clinic staff, in the pre and post side. So that's what we're doing every year. We're just transplanting more people, helping people get off dialysis, get better from cirrhosis, whatever end-stage organ disease that they have.
Where do you find most of your patients are coming from? Are they local to the Tampa market, or are you seeing individuals come in town to Tampa for the services that we offer?
Both, actually. We're definitely the largest transplant center on the west coast of Florida, so a lot of obviously local, surrounding Tampa Bay areas, but we also have patients come from other parts of the state, as far as South Florida, the Jacksonville area, the east coast of Florida, and even out of state. We have a partnership with the Kaiser Permanente program in California, just because their wait list time to wait for a kidney transplant is years longer than our time. So we have patients coming from California to get their kidney transplants, patients coming from New York. So we're really helping patients all across the board in far away in different states.
That's incredible.
Yeah.
That is amazing. Mm-hmm. Well, I am so excited to spend the morning with both of you. This has been super, super inspiring. As we kind of wrap up today's session, is there anything that you would give advice to? So if I'm a guidance counselor, I'm a parent, I am a principal at a local school, I'm a high school student trying to figure out my path, is there any guidance that you would give to those that might be considering maybe healthcare is a pathway for me?
Yeah, absolutely. I think there's no shortcuts in healthcare, and there's no shortcuts in life in general, but especially healthcare, there's no shortcuts. So I think the harder you work, and you have to expect changes too. It's not always exactly how you draw it out. You know, you might have to go around a wall once or twice throughout your education and even in your career. So I think just sticking it out and doing what you love and finding what you love is key. And if you do what you love, you never work a day in your life.
That's good advice. I love it.
Yeah.
You got to top that now.
that is hard to top. I have actually said this in the past to upcoming medical students or residents or whoever. And I kind of alluded to this earlier, is just that this is not a means to an end. This is your life. You're living it. So don't put your life on hold. People always say, oh, I'll do this once this is done, or I'll, get to that once, whatever portion that they're in right now is done. Don't do that. This is your life now. Like, just keep living, get married, travel, have kids, take that pottery class. I don't know, whatever it is. But my point is, this is your life. This is not a means to an end. So just live.
Love it. I love it. Well, thank you both for joining us this morning. We are super, again, grateful for you both taking time to step out of the OR to join us on this segment. And we look forward to having you back at future segments.
Thank you so much.